In other news here tonight, North Star Health Alliance wants to start up a new ambulance service, but existing North Country squads don't believe it'll complement the area's emergency response. Instead, it'll compete with them, all part of a public forum on the topic, covered by 7 News reporter Mark Mason Jr.
Claxton, Hepburn, and Carthage Hospital want to start a new ambulance service, one to transport patients between facilities, not answer 911 calls.
There is absolute 100%, without a shadow of a doubt, evidence that public need exists here.
Before it can hit the road, the hospitals through North Star Health Alliance need the okay from the North Country Regional EMS Council. That's what this public hearing was for Tuesday night, where North Star officials described how wait times for medical transports can be longer than 3 hours. Dr. Ji Hee, an acting hospital director, had one patient with a dangerous infection requiring amputation, but couldn't get a transport.
This process went back and forth for 10 days. Patient eventually became septic shock, went into renal failure, and died.
While North Star officials argue under its proposal wait times would improve, opponents argued to combat longer wait times, more ambulances aren't needed, it's additional funding and staffing. Carthage Rescue Squad's Madeline Bruzo believes North Star's use of insurance claims and fundraising to start up its service would inevitably harm existing EMS.
Taking transports from Carthage Area Hospital is inequivalently taking away our source of income, which will inevitably force us to cut staffing and resources.
Watertown's Guilfoyle president claims the problems with wait times goes even deeper.
There are frequent times that patients are being placed into beds in hallways and waiting rooms of these facilities to wait to be seen. The applicant does not want to send patients to a closer facility because it does not want to take the time and make the effort to call those facilities to check further availability, opting instead to tie up valuable EMS resources transporting patients to Albany and points beyond.
To prove its point, North Star showed this data from August 2023 to August 2024. Almost 2,000 transport calls in St. Lawrence County where EMS was unable to respond. Nearly 1,000 calls in Jefferson County. EMS squads say they can't respond to transports for various reasons, but primarily because they are already transporting other patients to hospitals as far away as Valhalla, New York, a nearly 5-hour drive. A decision by the EMS Council didn't happen at the end of this meeting. Mark Mason Jr., 7 News.